Dr. Sean. I'll be your doctor today. Okay, I've been reading through your case notes, so I know exactly why it is you're here. Okay, so just having a look at your eye now. You just complained that you felt there was something actually in your eye. Yeah, okay, well, I'll have a look at that for you, and if there is anything in there, we will remove it for you. Okay? Alright, well, get yourself nice and relaxed. We'll take care of you, and everything is going to be just fine. Okay, let's get started then. Oops. Actually, that should go in the bin, really, shouldn't it? There we go. I don't want another malpractice suit on my hands, you know. Okay. First of all, I'm going to be just feeling around the eye, making sure there's nothing, that's causing any discomfort. So I'm going to be very gentle. Okay, just let me know if you feel any pain whatsoever. Okay, so just looking forward, wherever is comfortable for you. Okay, you can look at my nose if you wish. That's perfectly fine. All right, so just keep your head reasonably still for me. Okay. Just a little feel around the eyebrow area. Any pain at all when I do that? Okay. So I can't tell, just looking at your eye, the whites of the eye do look a little bloodshot, which is what you would expect to see if there is something irritating the eye. It doesn't always mean there's something necessarily in the eye. However, we will take a very good look in the eye in a moment, using a light. So no pain at all there. Okay, could you just close your eyes for me? I just want to be touching on your eyelid, just in gentle circular motions. Okay, so close your eyes for me. There we go. Okay, any pain when I do that? Any pain now? Okay, close your eyes again. Any pain there at all? Okay. Alright, well, I'm using a few different lights here, a couple of different lights I should say, and they are quite bright. Okay, so I'm just going to warn you now. I'll be shining this light in your eyes for approximately 3 seconds. Okay, so here we go, bright light coming in. Okay, yeah, alright. So I'm just going to use this different lights here. Okay, going to be looking through the magnification just so I can see if there's any scarring at all in the eye. Again, it's going to be quite bright, okay, but again, I'm just going to be using it for a few seconds. So here we go, bright light coming in. Okay, well, the eye does look fine. I did notice when using the first light that I can see something in your eye. Okay, so it's right in the corner there on this side of your left eye. Alright, so what I will be doing is using tweezers to try and extract that foreign particle. Okay, and then we'll be using possibly some wipes, possibly some drops or both, and also have a spray there as well, just to relieve any sort of uncomfortable feeling in the eye, as well as any sort of reddening, and just sort of expedite the healing process. Okay, so it won't be painful, don't worry. Alright, so tweezers in conjunction with the light, but this time I won't be shining the light directly into your eyes. Alright, so I'm just going to cover your eyes for a second. Okay, alright, so keep it nice and still for me. I'll try and get this nice and still. Okay, keeping still for me, that's wonderful. If you can blink, that's fine, yep. Alright, this is tricky. We'll get a few guys at getting this, and but we will get it out, I promise you that, okay? There we go. Alright. Let's go and have a quick look, okay? Okay. Yeah, I can't see anything else in that corner of the eye, and I'm satisfied that there's no other particles in any other part of your left eye. Alright, so what we're going to do now is just going to be relieving any discomfort. Okay, we can use a variety of different methods here. I'm just going to be deciding which is best for your case. Okay, so if you don't mind, I think I want to just have a clean around the area around the eye itself, just to make sure there's nothing else around the eye that could possibly cause any further irritation. Okay, so it's just an alcohol pad just to clean the area around the eye, so there'll be no pain or anything like that. Small, these things, they can be pretty tricky. You can get a strong waft of alcohol, which is quite often the smell you think of when you go to things like the doctors or the dentist or hospital. Okay, so keep it nice and still for me. Just going to be rubbing this around the eye. Just holding your head still. Okay, thank you very much. Okay, just keep it still. Doing a good thorough job. Make sure that you're not coming back in. So we like to take good care of our patients. Okay, I think that's about it. Alright, that's good. Pop this in a bit. There we go. Alright, that's good. Okay, so I think just as a follow-up, I want to be treating the eye itself using some drops here, okay? So again, there's no pain involved, nothing like that, okay? So all it's going to do is make sure the eye is nice and clean, so there's no further irritation. Okay. Alright. So you don't have to put your head back. It is helpful if you just raise your chin a tiny bit for me, but you know, I can put these in quite simply, so you don't really need to aid me by tilting your head massively far back, but if you can just tilt your chin ever so slightly, that should be more than enough. Okay, so tilting your head ever so slightly. Okay, that's good. Okay, it's getting quite busy now. I missed that one, that went on the floor, that one. There we go. Okay, that's good. Making sure. Get every area of the eye. Yeah, we're quite close to the A&E department, so it can get pretty rowdy at times. Oh, okay, we're going to get some more here. Just a couple more, just to make sure, you know, we've got a great coating on there. Okay, so keep it still for me. Oh, there we go, nice big one there. And there we go. Alright, that's fantastic. So you may find there's a slight sensation there, but you know, it's doing its job now, so you might find a slight almost like a, not a fizzing, but like a sort of almost like a stinging, but it doesn't actually hurt, but it is doing its job now, so just have to maybe blink a little bit more than you normally would for the next 10 minutes. Alright, so now I'm just going to let those drops do its thing just for a moment, and then if you don't mind, I would like to actually test your vision. Okay, so I can compare the good eye, as it were, to the bad eye. Alright, so a very simple test, but we'll just do those in a moment, okay? Alright, so get yourself nice and comfortable, blink a few times. Okay, now I'm going to be holding up my fingers either side of my head like so. Okay, I want you to tell me which set of fingers are twitching. Okay, we use your left and your right. Alright, are you ready? Okay, so tell me which set of my fingers are twitching. Here we go. Good. Okay, well done. That can be quite difficult at times, but you did very well there, so that's the first test passed. Okay, so we move on to the chart here. Okay, using both your eyes, I want you to read off this line here. So when I point to the letter, I want you to guess or tell me what it is. If you don't know what it is, the best guess is perfectly acceptable. Alright, here we go. Both eyes open. Okay, now if you could close over your left eye for me. Okay, I want you to read this line here, starting with this letter here. Okay, here we go. Okay, now if you could close the other eye for me, I want you to read the very same line but backwards. Okay, that's wonderful. Now can you tell me which colour this is, please? And this colour, what do you see there? Okay, which, if any, of the two lines appears thicker or easier to see? Okay. You've done very well, so I'm not concerned with anything so far. Okay, so well done you. Right, just going to use a separate different light here. I want to just check around the eye just to see what the alcohol prep pad, if it made any difference, if it, because it's possible it could inflame the eye, so we're just making sure there's no adverse reaction to the prep pad. Okay, looks fine so far. Yeah, some people have very sensitive skin on the face. Quite a lot of people do, so it's always worth checking that something that we try to help you with doesn't actually have any adverse effects. Okay, so we've done the drops, applied the antiseptic. Okay, that's wonderful. I think we're just going to have a quick spray around the area, so I want you to keep your eyes shut for me, alright? And it sort of doubles down on the whole cleaning process, okay? So keep your eyes shut for me. Okay, so I'm going to put my hand here just to make sure you don't open your eyes at any opportune moment and get a square in the eye. Not fun. There we go, just around the eye. Okay, that looks wonderful. Alright, so I'm going to be asking you now to follow my fingers. Okay, I'm going to pop a pair of gloves on actually, just to make this a little bit easier. Just the blue contrasts better against my white lab coat, I find. Okay. So the idea is I want you to track the tips of my fingers using just your eyes, okay? So keep your head perfectly still, just moving your eyes and track the very tips of my two fingers, okay? So both eyes open, head still, tracking the fingers. While you do this, I will be checking both eyes. That includes obviously a good eye and the not so good eye. And seeing as you only have two eyes, it's just as well. It's good. Okay, I'm going to speed it up a little bit now just to make it a little bit tricky. Making sure that the injured left eye is tracking with little to no difficulty, which is exactly what it seems like it's doing. Good. There we go, just varying the patterns to make it more difficult. Okay, well done. So I think that's about it now. We've tested you with all the basic sight tests, okay, and there's nothing I found to be concerning or anything like that. You've passed all the tests, and hopefully within about 10 minutes or so any irritation around the eye and in the eye itself will have subsided. Okay, but if there's any problems, do pop back in. We'll be more than happy to take a look for you. Alright, well, take care of yourself. Lovely to meet you. Okay, take care. Bye bye then.